Hello everyone, if you are preparing for DHA, MOH, HAAD or Indian government exams in 2026, skipping this video could literally cost you your dream job. Welcome back to part 2 of our exam special. We have analyzed the last 5 years of previous year question papers across Gulf Prometric and Indian government board to bring you the ultimate 150 high yield MCQs. We aren't just giving you the answer, we are giving you the exact logic to crack them. I will give you concise explanation right here in the video, but if you want the deep dive textbook explanation, check the pinned comment and join our Telegram channel. Let's do not waste any time, starting with our highest priority topic. Question number 1. A patient presents with shoulder pain. The physiotherapist performs a test by internally rotating the patient's arm so the thumb points to the floor and applying downward resistance. Which muscle is primarily being isolated? Option A, infraspinatus. Option B, subscapularis. Option C, supraspinatus. Option D, teres minor. And the answer is option C, supraspinatus. This is empty-can test or Jobs test, specifically designed to isolate and test the supraspinatus muscle and tendon. Okay. Now let's move to question number 2. In Glasgow Coma Scale or GCS scale, what is the maximum possible score a patient can achieve, indicating a full, awake and oriented individual? Option A 13, option B 14, option C 15, option D 16. And the answer is option C 15. The highest GCS score is 15, derived from eye opening 4, verbal response 5 and motor response 6. Okay, let's move to question number 3. When using therapeutic ultrasound, which term describes the area of the transducer from which the ultrasound energy radiates? Option A, effective radiating area, ERA. Option B, beam non-uniformity ratio, BNR. Option C, spatial average intensity. Option D, duty cycle. And the answer is option A, effective radiating area, ERA. ERA is the actual surface of the ultrasound head that transmits the sound waves and is always slightly smaller than the physical size of the sound head. Okay. Now let's move to question number 4. A 65-year-old patient with COPD undergoes pulmonary function test. Which spirometry finding is the hallmark of an obstructive lung disease? Option A, FE1 bar FEC ratio greater than 80%. Option B, FE1 bar FEC ratio less than 70%. Option C, decreased total lung capacity, that's CLC. Option D, increased vital capacity, that's VC. And the answer is option B, FE1 bar FEC ratio less than 70%. Obstructive disease traps air, making it hard to exhale quickly. This dropped the FE1 bar FEC ratio below 70%. I think you got it. Now let's move to question number 5. During the stance phase of the gait, the patient exhibits a pelvic drop on the right side when the left leg is weight bearing. Which muscle is weak? Option A, right gluteus maximus. Option B, right gluteus medius. Option C, left gluteus medius. Option D, left quadratus lumborum. And the answer is option C, left gluteus medius. This is a positive Tenderberg sign. The weak gluteus medius on the stance leg, that's left side, fails to hold the pelvis level, causing the opposite side, that's right side, to drop. Okay. Now let's move to question number 6. According to the convex-concave rule, if a convex joint surface is moving on a stationary concave surface, how do the osteokinematic roll and arthrokinematic glide occur? Option A, roll and glide occurs in the same direction. Option B, the roll and the glide occurs in the opposite direction. Option C, only pure rolling occurs. Option D, only pure gliding occurs. And the answer is option B, the roll and the glide occurs in opposite direction. When convex moves on a concave, the bone rolls one way but the joint surface glide the opposite way to stay in the socket, like humerus in the glenoid. Now let's move to question number 7. Autonomic dysreflexia is a medical emergency most commonly seen in patients with a spinal cord injury at or above which neurological level? Option A T6, option B T10, option C L2, option D C8. And the answer is option A T6. It occurs at lesions T6 and above due to noxious stimuli like a full bladder, causing a massive sympathetic spike that the brain cannot regulate. Now let's move to question number 8. Which is the most common type of cerebral palsy characterized by hypertonia and muscle stiffness, often affecting the lower extremity more than the upper extremity? Option A Ethetoid CP, option B ataxic CP, option C spastic hemiplegia, option D spastic diaplegia. And the answer is option D spastic diaplegia. Spastic diaplegia is the commonest form, okay, particularly in premature infants, heavily involving the leg, resulting in a scissoring gait. Okay, now let's move to question number 9. Conventional transcutaneous electrical nerve stimulation, that's TENS, primarily provide pain relief through which physiological mechanism? Option A endorphin, option B descending pain inhibition, option C gate control theory, option D vasodilation. And the answer is option C gate control theory. Conventional TENS uses high frequency and low intensity to stimulate A beta fiber, which close the gate to pain signals in the spinal cord. Now let's move to question number 10. On a standard electrocardiogram, that's ECG, what does the P wave represent? Okay. Option A ventricular repolarization, option B atrial depolarization, option C ventricular depolarization, option D atrial repolarization. And the answer is option B atrial depolarization. The P wave is the first little bump on the ECG showing electrical firing, that's depolarization of the atria before they contract. Okay. Now let's move to question number 11. A patient complained of numbness in the thumb, index and middle fingers, especially at night. Which nerve is compressed in the carpal tunnel syndrome? Option A median nerve, option B ulnar nerve, option C radial nerve, option D musculocutaneous nerve. And the answer is option A median nerve. The median nerve runs through the carpal tunnel and supplies sensation to the lateral 3.5 fingers or digit. Okay. Now let's move to question number 12. A patient suffers a stroke involving the middle cerebral artery, MCA. Which clinical presentation is most characteristic? Option A contralateral lower extremity weakness greater than upper extremity weakness. Option B ipsilateral hemiparesis. Option C contralateral upper extremity and facial weakness greater than lower extremity. Option D complete bilateral paralysis. And the answer is option C contralateral upper extremity and facial weakness greater than lower extremity. MCA stroke typically hit the face and the arm harder than the legs. If the legs are worse, it would be an anterior cerebral artery, that's ACA stroke. Okay. Now let's move to question number 13. In physiotherapy research, a p-value is used to determine statistical significance, typically a result considered statistically significant if p-value is option A greater than 0.05, option B less than 0.05, option C equal to 1, option D greater than 0.10, that's 10. And the answer is option B less than 0.05. A p-value of less than 0.05 means there is a less than a 5% probability that the result of the study happens by pure chance. Okay. Now let's move to question number 14. In biomechanics, raising upon your tiptoes, that's plantar flexion, act as which class of lever in human body? Option A, first class lever. Option B, second class lever. Option C, third class lever. Option D, fourth class lever. And the answer is option B, second class lever. Calf raise act as second order lever or second class lever. The fulcrum is the toes, load is the body weight in the middle, and the effort, that's the calf muscles, is at the heel. Okay. Now let's move to question number 15. A 60-year-old female fall on an outstretched hand, resulting in fracture of the distal radius with dorsal displacement. What is the classic deformity associated with this fracture? Option A, Botandai deformity. Option B, swan neck deformity. Option C, garden spade deformity. Option D, dinner fork deformity. And the answer is option D, dinner fork deformity. A Colles fracture, that's dorsal displacement, creates a characteristic bump on the wrist that look exactly like a dinner fork facing downward. Okay. Now let's move to question number 16. Parkinson's disease is a neurodegenerative disorder affecting the basal ganglia. What is the classical clinical triad of Parkinson's disease? Option A, tremor, rigidity, bradykinesia. Option B, spasticity, hyperreflexia, clonus. Option C, ataxia, intention tremor, nystagmus. Option D, flaccidity, fasciculation, muscle atrophy. And the answer is option A, tremor, rigidity, bradykinesia. So Parkinson's disease is marked as a resting rolling pill tremor, lead pipe or cogwheel rigidity, and bradykinesia, slowed movement. Okay. Now let's move to question number 17. During phase 1 inpatient of cardiac rehabilitation, what is generally accepted maximum MET, metabolic equivalent, level for a patient activities before discharge? Option A, 1 to 3 METs. Option B, 4 to 6 METs. Option C, 7 to 9 METs. Option D, 10 to 12 METs. And the answer is option A, 1 to 3 METs. Phase 1 rehab is just about getting the patient stable enough to go home. So activities are kept very light, usually between 1 to 3 METs. Okay. Now let's move to question number 18. What is the standard frequency used for a short wave diathermy SWD in physiotherapy clinics to comply with international radio regulation? Option A, 1 MHz. Option B, 27.12 MHz. Option C, 2450 MHz. Option D, 50 MHz. And the answer is option B, 27.12 MHz. So SWD uses radio waves to heat deep tissues, and the standard and globally approved frequency is 27.12 MHz. Okay. Now let's move to question number 19. The Moro reflex is a primitive reflex normally present in full-term infants. At what age does it typically integrate, disappears? Okay. Option A, 1 to 2 months. Option B, 2 to 3 months. Option C, 4 to 6 months. Option D, 8 to 12 months. And the answer is option C, 4 to 6 months. The Moro or startail reflex, where a baby throws its arm out, usually disappears between 4 to 6 months of the age as the nervous system matures. Okay. Now let's move to question number 20. Which special test is considered the most sensitive clinical test for diagnosing an anterior cruciate ligament ACL rupture? Option A, Leachman test. Option B, anterior Royce test. Option C, pivot shift test. Option D, McMurray test. And the answer is option A, Leachman test. While anterior Royce test is famous, the Leachman test done at 20 to 30 degree of knee flexion, the most or more sensitive and accurate for acute ACL tear. Okay. Now let's move to question number 21. Bell's palsy is a condition resulting in sudden temporary weakness or paralysis of the muscle on one side of the face. Which cranial nerve is affected? Option A, trigeminal nerve. Option B, oculomotor nerve. Option C, vagus nerve. Option D, facial nerve. And the answer is option D, facial nerve. Bell's palsy target facial nerve, as you know, right, leading into drooping of mouth and inability to close the eyes on the affected side. Okay. Now let's move to question number 22. During a normal human walking cycle, what percentage of the gait cycle is comprised of the stance phase? Option A, 40%. Option B, 60%. Option C, 80%. Option D, 50%. And answer is option B, 60%. In normal walking, your foot is on the ground. That's the stance phase for 60% of the time, and the swing phase in the air for 40%. Total 100%. Okay. Now let's move to question number 23. A physiotherapist is using iontophoresis to treat a patient with a calcific tendinitis of the supraspinatus. Which medication is most appropriate to drive into the tissue to help resolve the calcium deposit? Option A, dexamethasone. Option B, lignocaine. Option C, acetic acid. Option D, zinc oxide. And the answer is option C, acetic acid. Acetic acid is negatively charged and is specifically used in iontophoresis to break down the calcium deposit in the tendons. Okay. Now let's move to question number 24. When performing a postural drainage for a patient with cystic fibrosis, what is the proper patient positioning to drain the apical segment of the upper lobe? Option A, sitting upright, leaning slightly backward. Option B, prone with the bed flat. Option C, supine with the head of the bed tilted down 18 inches. Option D, side lying with bed flat. And the answer is option A, sitting upright with leaning slightly backward. To drain the very top of the lungs, gravity requires the patient to be seated slightly reclined position. Okay. Now let's move to question number 25. Ankylosing spondylitis is a chronic inflammatory disease affecting the axial skeleton. Which generic marker is strongly associated with this condition? Option A, rheumatoid factor. Option B, HLA-B27. Option C, anti-CCP. Option D, ANA. And the answer is option B, HLA-B27. Over 90% of patients with ankylosing spondylitis test positive for HLA-B27 generic marker, making it a key diagnostic clue. Okay. Let's move to question number 26. Guillain-Barré syndrome (GBS) is an acute demyelinating polyneuropathy. What is the classic pattern of muscle weakness presentation in these patients? Option A, asymmetrical descending weakness. Option B, symmetrical ascending weakness. Option C, proximal muscle weakness only. Option D, unilateral facial weakness only. And the answer is option B, symmetrical ascending weakness. GBS typically presents with a symmetrical ascending weakness, meaning it starts in the feet and legs and moves it way up the body bilaterally. Okay, now let's move to question number 27. When applying ultraviolet radiation UVR for the treatment of psoriasis, what is the primary physiological effect of SOT? Option A, deep tissue heating. Option B, exfoliation and decrease in DNA synthesis. Option C, vasoconstriction. Option D, enhancement of nerve conduction velocity. And the answer is option B, exfoliation and decrease in DNA synthesis. UVR primarily works on the skin condition like psoriasis by slowing down the rapid abnormal growth of the skin cells DNA synthesis and causing mild exfoliation. Okay. Now let's move to question number 28. A 14-year-old female gymnast complains of localized low back pain. Radiograph revealed a bilateral pars interarticularis defect with a forward slippage of L5 on S1. What is the condition called? Option A, spondylosis. Option B, spondylitis. Option C, spondylolisthesis. Option D, spondylolysis. And the answer is option C, spondylolisthesis. The listhesis part of the word means slippage because L5 has a slipped forward over S1 due to the Paris defect. It is spondylolisthesis. Okay. Now let's move to question number 29. On a ECG, what specific finding is the most definitive early indicator of an acute full thickness myocardial infarction? Option A, prolonged PR interval. Option B, ST segment elevation. Option C, peaked T waves. Option D, inverted U waves. And the answer is option B, ST segment elevation. ST segment elevation is the intermediate red flag for an acute full thickness heart attack, also known as STEMI. Now let's move to question number 30. A physical therapist is performing joint mobilization to increase glenohumeral abduction. According to the convex-concave rule, in what direction should the mobilization glide be applied? Option A, superior glide. Option B, anterior glide. Option C, posterior glide. Option D, inferior glide. And answer is option D, inferior glide. The convex head of the humerus rolls superiorly during abduction to keep it in the socket. It must glide inferiorly, that's downward. Okay. Now let's move to question number 31. Duchenne's muscular dystrophy (DMD) is an X-linked recessive disorder. Which clinical sign is classically observed when these children attempt to rise from the floor? Option A, Ettenberg sign. Option B, Gover's sign. Option C, Lermith sign. Option D, Babinski sign. And the answer is option B, Gover's sign. Children with DMD have profound proximal muscle weakness, forcing them to walk their hands up their own legs to stand. This is called as Gover's sign. Okay. Let's move to question number 32. In diagnostic testing, what term describes a test ability to correctly identify individuals who do not have the disease, the true negatives? Option A, sensitivity. Option B, specificity. Option C, positive predictive value. Option D, relatability. And the answer is option B, specificity. Specificity looks at the true negatives. A highly specific test means if the patient tests positive, you can be sure they actually have the disease. Okay. Now let's move to question number 33. A patient presents with paresthesia in the medial core distribution of the brachial plexus and vascular compromise in the upper limb. Which of the following special test is most appropriate for diagnosing thoracic outlet syndrome caused by scalene muscle spasm? Option A, Fallon's test. Option B, Hudson test. Option C, Tinel sign. Option D, Allen test. And answer is option B, Hudson test. This test specifically checks for the compression of the neurovascular bundle between the anterior and the middle scalene muscle by having the patient extend and rotate their head towards the tested side. Okay. Now let's move to question number 34. A patient sustains a hemicession of spinal cord at T10 level, Brown-Square syndrome. What sensory and motor loss pattern will they exhibit below the level of lesion? Option A, ipsilateral loss of pain or temperature, contralateral loss of motor or proprioception. Option B, bilateral loss of motor function, preserved sensation. Option C, ipsilateral loss of motor or proprioception, contralateral loss of pain or temperature. Option D, bilateral loss of pain and temperature only. And the answer is option C, ipsilateral loss of motor or proprioception, contralateral loss of pain or temperature. Because the pain and temperature tracks crosses over early in the spinal cord, but motor and proprioception tract crosses in the brainstem, hemicession causes a split. Motor or proprioception loss on the same side, pain or temperature lost on the opposite side. I think you got it. Now let's move to question number 35. When performing iontophoresis to deliver dexamethasone for plantar fasciitis. Which polarity should the active electrode have? Option A, positive anode. Option B, negative cathode. Option C, alternating current. Option D, neutral. And the answer is option B, negative cathode. Dexamethasone is negatively charged ion because like charges repel, you must use negative electrode, the cathode, to push the medication into the skin. Okay. Now let's move to question number 36. Cor pulmonale is a cardiac condition characterized by hypertrophy and failure of the right ventricle. It is most commonly caused by option A, left ventricular failure. Option B, systemic hypertension. Option C, mitral valve prolapse. Option D, pulmonary hypertension secondary to lung disease. And answer is option D, pulmonary hypertension secondary to lung disease. Cor means heart, pulmonale means lungs. This is when the severe lung disease causes high pressure into the lungs, overworking the right side of the heart until it fails. Okay. Now let's move to question number 37. The Q angle or the quadriceps angle is clinically important for evaluating patellofemoral tracking. It is formed by intersection of the line from the ASIS to the mid-patellar and a line from option A, the greater trochanter to the mid-patella. Option B, the tibial tuberosity to the mid-patella. Option C, the pubic symphysis to the mid-patella. Option D, the fibula head to the mid-patella. And answer is option B, the tibial tuberosity to the mid-patella. The Q angle measures the pull of the quadriceps. To draw one line from ASIS down to the kneecap and second line from the kneecap straight down to the tibial tuberosity. Okay. Now let's move to question number 38. Frankelsen test is used to diagnose recurrent stenosynovitis. Which two tendons are inflamed in this condition? Option A, extensor pollicis longus and extensor indicis. Option B, abductor pollicis longus and extensor pollicis brevis. Option C, flexor pollicis longus and flexor carpi radialis. Option D, extensor carpi radialis longus and brevis. And the answer is option B, abductor pollicis longus and extensor pollicis brevis. Recurrence affect the first dorsal compartment of the wrist. Remember the mnemonic apple and peanut butter. Abductor pollicis longus and extensor pollicis brevis. Okay. Now let's move to question number 39. A patient complains of brief, severe episode of vertigo when rolling over in bed. The Dix-Halpic maneuver is positive with unbeating and torsional nystagmus. What is the most likely diagnosis? Option A, Meniere's disease. Option B, vestibular neuritis. Option C, posterior canal benign proximal positional vertigo. Option D, acoustic neuroma. And the answer is option C, posterior canal benign proximal positional vertigo. That's PPPV. Brief vertigo triggered by the health position changes like the rolling in bed combined with the unbeating nystagmus during the Dix-Halpic test is the hallmark presentation of the posterior canal BPPV. Okay. Now let's move to question number 40. During a straight leg raise, SLR test, the patient experienced sharp shooting pain down the back of the leg at 45 degrees of hip flexion. Adding angle dorsiflexion exhibit the pain. This strongly indicates option A, hamstring tightness. Option B, sciatic nerve irritation or radiculopathy. Option C, sacroiliac joint dysfunction. Option D, piriformis syndrome only. And the answer is option B, sciatic nerve irritation or radiculopathy. The sharp shooting nature of the pain at 45 degrees combined with the fact that dorsiflexion, Burgard's sign, okay, not the word, Burgard's sign, makes it worse, proves this is the nerve tension, specifically the sciatic nerve, not just the tight hamstring. Okay. Now let's move to question number 41. Which neural tube defect is characterized by a cystic sac protruding from the spine that contains meninges, CSF, and spinal cord or nerve roots, resulting in severe motor and sensory deficit? Option A, spina bifida oculata. Option B, meningocelia. Option C, myelomeningocele. Option D, anencephaly. And the answer is option C, myelomeningocele. Myelo means spinal cord, meningio means meninges, and coli means swelling. A myelomeningocele is the most severe form of spina bifida, where the actual spinal cord is outside the neural arch. Okay. Now let's move to question number 42. A physiotherapist is using pulsed ultrasound for tissue healing in an acute angle sprain. To minimize thermal effect and maximize non-thermal mechanical effect, which duty cycle is most appropriate? Option A 100%, option B 50%, option C 20%, option D 80%. And the answer is option C 20%. To get the healing benefit of ultrasound without adding the heat to an already swollen acute injury, you must pulse the machine at low duty cycle, specifically at 20%. Okay. Now let's move to question number 43. A patient is asked to actively flex their knee while their hip is fully extended. Example, prone lying. They cannot achieve full knee flexion. However, when the hip is flexed, full knee flexion is easily achieved. This inability to maximally contract across two joints simultaneously is called option A, passive insufficiency, option B, active insufficiency, option C, tenodesis, option D, reciprocal inhibition. And the answer is option B, active insufficiency. The hamstring are two joint muscles, extending the hip, flexing the knee. When they try to do both action at the same time, they run out of contractibility. Okay, this is active insufficiency. Okay. Now let's move to question number 44. Which condition is characterized by a painful global restriction of shoulder motion, classically presenting with capsular pattern of restriction? External rotation, abduction, internal rotation. Option A, subacromial impingement syndrome. Option B, baccipital tendinitis. Option C, adhesive capsulitis. Option D, slap lesion. And the answer is option C, adhesive capsulitis. Adhesive capsulitis or frozen shoulder restrict the entire joint capsule. It always follows a specific pattern of loss. External rotation is lost the most, followed by abduction and then internal rotation. Okay. Now let's move to question number 45. According to the Asia Impairment Scale AIS for spinal cord injury, a patient who has motor function preserved below the neurological level and more than half of the key muscles below the neurological level have a muscle grade less than 3 is classified as option A, AIS-A, option B, AIS-B, option C, AIS-C, option D, AIS-D. And the answer is option C, AIS-C. In AIS-C, motor function is incomplete, but the muscle below the lesion are weak, grade less than 3. If they are strong, grade 3 or higher, it would be AIS-D. Okay. Now let's move to question number 46. Postural drainage is a critical airway clearance technique. Which of the following is an absolute contraindication for placing a patient in Tenterberg position, head down for drainage? Option A, cystic fibrosis. Option B, bronchostasis. Option C, increased intracranial pressure. Option D, chronic bronchitis. And the answer is option C, increased intracranial pressure. Okay. Tipping a patient head down increases blood flow and pressure to the brain. If they already are dangerously high intracranial pressure, this position could be fatal. Okay. Now let's move to question number 47. During an assessment of knee, the physiotherapist flexes the knee to 90 degrees while the patient is prone, stabilizes the thigh and applies a downward compressive force through the heel while internally and externally rotating the tibia. Pain or clicking indicate a positive test. Which test is this? Option A, Upley's compression test. Option B, Thisley test. Option C, Clerk sign. Option D, valgus stress test. And the answer is option A, Upley's compression test. This test grinds the meniscus between the femur and tibia. If it causes pain or catching, it strongly points to meniscal tear. Okay? Now let's move to question number 48. In the context of medical ethics and healthcare administration, the principle of autonomy primarily refers to option A, the therapist's duty is to do no harm. Option B, the equitable distribution of healthcare resources. Option C, the patient's right to make their own healthcare decision. Option D, truthfulness in documentation. And the answer is option C, the patient's right to make their own healthcare decision. Autonomy is all about the patient choice. It means a mentally concerned patient has an ultimate right to accept or refuse treatment regardless of therapist advice. Okay? Now let's move to question number 49. Multiple sclerosis is a demyelinating disease of central nervous system. Which of the following clinical finding is a common autonomic dysfunction associated with MS? Option A, resting tremor. Option B, spasticity. Option C, neurogenic bowel and bladder. Option D, flaccid paralysis. And the answer is option C, neurogenic bowel and bladder. While spasticity is common in MS, it's a motor issue. The question asks for the autonomic issue. The autonomic nervous system controls involuntary things like bowel and bladder movements. Okay? Now let's move to question number 50. A 40-year-old male presents with sudden inability to actively plantar flex his foot after feeling a pop in his posterior calf during tennis match. A positive Thompson test is noted. What is the diagnosis? Option A, medial gastrocnemius tear. Option B, Achilles tendon rupture. Option C, posterior tibial tendon dysfunction. Option D, deep vein thrombosis. And the answer is option B, Achilles tendon rupture. The pop during explosive movement combined with positive Thompson test while squeezing the calf fails to make the foot plantar flex. Okay, confirm a complete rupture of Achilles tendon. Okay. Now let's move to question number 51. A patient with a stable angina experiences chest pain during a treadmill exercise test. The pain is relieved within 3 minutes by resting and taking sublingual nitroglycerin. What is the primary mechanism of nitroglycerin? Option A, decrease heart rate directly. Option B, vasodilation of the coronary artery and systemic veins. Option C, increase myocardial oxygen demand. Option D, blocks beta adrenergic receptors. And the answer is option B, vasodilation of coronary artery and systemic veins. So nitroglycerin is a powerful vasodilator. It opens up the blood vessel, delivering more oxygen to the heart muscles while also reducing the amount of blood returning to the heart, giving the heart a much needed break. Okay. Now let's move to question number 52. According to the Rancho Los Amigos level of cognitive functioning scale for traumatic brain injury (TBI), a patient who exhibits a confused agitated response is classified at which level? Option A, level 2. Option B, level 4. Option C, level 6. Option D, level 8. And the answer is option B, level 4. This is when the patient is waking up and severely disoriented and often aggressively acting out because they cannot process their environment. Okay. Now let's move to question number 53. Therapeutic ultrasound is contraindicated over the epiphyseal plate of growing children primarily to prevent which adverse outcome? Option A, malignant bone tumor formation. Option B, premature closure of the growth plate. Option C, severe bone demineralization. Option D, hypertrophy of the articular cartilage. And the answer is option B, premature closure of the growth plate. Applying deep heat or mechanical energy from ultrasound over a child's growth plate can damage it, cause the bone to stop growing prematurely and leading to limb length discrepancy. Okay. Now let's move to question number 54. Which type of skeletal muscle fibers are primarily recruited during a marathon run due to their high fatigue resistance and high capillary density? Option A, type 2B. Option B, type 2A. Option C, type 1. Option D, type 3. And the answer is option C, type 1, slow twist oxidative. Okay. They have a ton of oxygen carrying myoglobin, making them highly resistant to fatigue, perfect for a marathon. Okay. Now let's move to question number 55. A 22-year-old male falls onto his outstretched hand. He presents with a severe tenderness in the anatomical snuff box. X-ray taken on day 1 are negative. What is the most likely injured structure and what is the primary risk if mismanaged? Option A, lunate dislocation, carpal tunnel syndrome. Option B, scaphoid fracture, avascular necrosis. Option C, Colles fracture, malunion. Option D, first metacarpal fracture, osteoarthritis. And the answer is option B, scaphoid fracture, avascular necrosis. Tenderness in the anatomical snuff box after a fall is a scaphoid fracture until proven otherwise. Even if the first X-ray is clean, the huge danger here is the vascular necrosis because of the bone's poor blood supply. Okay. Now let's move to question number 56. When assessing an infant, turning the head to the right causes the right arm and the leg to extend and the left arm and the left leg to flex. This describes a primitive reflex. Option A, symmetrical tonic neck reflex. Option B, asymmetrical tonic neck reflex. Option C, tonic Leberdyne reflex. Option D, Galen reflex. And the answer is option B, asymmetrical tonic neck reflex. That's ATNR. This is the classic fencing posture, officially known as the asymmetrical tonic neck reflex. That's ATNR. The limbs on the face side extend and the skull side limb flex. Okay. Now let's move to question number 57. A physiotherapist is monitoring a patient during phase 2 cardiac rehabilitation. Which of the following is an absolute indication to immediately terminate the exercise session? Option A, heart rate increased by 15 bpm above resting. Option B, systolic blood pressure drops by greater than 10 mmHg for baseline despite an increase in workload. Option C, diastolic blood pressure above to 95 mmHg. Option D, patient reported rate of perceived exertion RBE of 13 on the box scale. And the answer is option B, systolic blood pressure drops by greater than 10 mmHg for baseline despite an increase in workload. If the patient is exercising harder, their systolic blood pressure should go up. If it suddenly drops by more than 10 points, the heart is failing to pump effectively and you must stop immediately. Okay. Now let's move to question number 58. A patient recovering from a stroke presents with profound weakness and sensory loss in their right lower extremity, but their right upper extremity and face are largely spared. They also exhibit urinary incontinence. Which cerebral artery was most likely occluded? Option A, medial cerebral artery. Option B, anterior cerebral artery. Option C, posterior cerebral artery. Option D, basilar artery. And the answer is option B, anterior cerebral artery. The middle cerebral artery hits the face and arm. The anterior cerebral artery derives deep into the midline of the brain, wiping out the legs and the bladder control. Now let's move to question number 59. When setting up acupuncture-like tents for chronic pain management, what are the most appropriate parameters? Setting. Option A, high frequency, short pulse duration, sensory level intensity. Option B, low frequency, long pulse duration, motor level intensity. Option C, high frequency, long pulse duration, nauseous level intensity. Option D, low frequency, short pulse duration, subsensory level intensity. And the answer is Option B, low frequency, long pulse duration, motor level intensity. So acupuncture like tensor is designed to make the muscle twitch. To do with this without causing annoy, you need a low frequency, that's 2 to 4 twitch per second, but a wide, powerful pulse to grab the motor nerves. Okay. Now let's move to question number 60. In statistical research, what happens when the researcher commit a type 1 error? Option A, they fail to reject a false null hypothesis. Option B, they conclude there is no difference when one actually exists. Option C, they reject a true null hypothesis, finding a false positive. Option D, they use an inappropriate statistical test for ordinal data. And the answer is option C, they reject a true null hypothesis, finding a false positive. A type 1 error is a false positive. It means the researcher claims their new treatment works brilliantly, but in reality, it does not work at all, and result were just pure luck. Okay. Now let's move to question number 61. The O'Brien test, active compression test, is utilized to diagnose pathology in which specific structure of the shoulder? Option A, acromioclavicular joint and slap lesion. Option B, subscapularis tendon. Option C, transverse femoral ligament. Option D, inferior glenohumeral ligament. And the answer is option A, acromioclavicular joint and slap lesion. This test checks two things. If the pain is deep inside the joint, it's a slap tear, that's labrum. If the pain is on the top of the shoulder, it's an AC joint injury. Okay. Now let's move to question number 62. A 55-year-old female reports sharp, lancinating pain on the right side of the face triggered by chewing or brushing her teeth. Neurological examination point to trigeminal neuralgia. Which cranial nerve is affected and what type of nerve is it? Option A, cranial nerve 7, purely sensory. Option B, cranial nerve 5, mixed motor and sensory. Option C, cranial nerve 9, mixed. Option D, cranial nerve 12, purely motor. And the answer is option B, cranial nerve 5, mixed. So trigeminal neuralgia, also called tic douloureux, affects cranial nerve 5. The trigeminal nerve is a mixed nerve. It provides sensation to the face but also control the muscles of chewing. That's mastication. Okay. Now let's move to question number 63. During the initial contact, that's heel strike phase of the normal gait cycle, what type of muscle contraction are the angle dorsiflexors performing? Option A, concentric contraction. Option B, eccentric contraction. Option C, isometric contraction. Option D, isokinetic contraction. And the answer is option B, eccentric contraction. At the heel strike, gravity wants to slap your foot down into the plantar flexion. Your dorsiflexors, like the tibialis anterior, must act as a brake, lengthening while contracting to slowly lower the foot. This braking action is an eccentric contraction. Okay? Now let's move to question number 64. A key clinical differentiator between osteoarthritis and rheumatoid arthritis is the duration of morning joint stiffness. Which of the following statement is clinically accurate? Option A, OA stiffness lasts greater than 1 hour, RA stiffness lasts less than 30 minutes. Option B, OA and RA both cause stiffness lasting greater than 2 hours. Option C, RA stiffness lasts greater than 1 hour, OA stiffness lasts less than 30 minutes. Option D, morning stiffness is present in RA but completely absent in OA. And the answer is option C, RA stiffness lasts greater than 1 hour, OA stiffness lasts less than 30 minutes. Rheumatoid arthritis is a systemic inflammatory disease, so patients wake up incredibly stiff for over an hour. Osteoarthritis is a mechanical wear and tear. They might be stiff for 10 to 15 minutes, but they loosen up quickly once they start moving. Okay? Now let's move to question number 65. A patient with severe chronic obstructive pulmonary disease (COPD) is clinically referred to as blue bloater. This physical presentation is primarily associated with which specific condition? Option A, emphysema. Option B, chronic bronchitis. Option C, asthma. Option D, cystic fibrosis. And answer is option B, chronic bronchitis. Blue borders refers to the patient with chronic bronchitis. The blue comes from the cyanosis due to the lack of oxygen, and bloater comes from the right side heart failure causing fluid retention and swelling. Okay. Now let's move to question number 66. Which class of low-level laser therapy is widely used in physiotherapy clinics and requires the use of protective eyewear due to its potential to cause retinal damage with direct viewing? Option A, class 1. Option B, class 2. Option C, class 3B. Option D, class 4. And the answer is option C, class 3B. Most therapeutic cold lasers used in our clinics are class 3B. They operate between 5 to 500 milliwatts. They won't burn your skin, but if the laser hits your eye, it will cause permanent retinal damage. So goggles are mandatory. Okay. Now let's move to question number 67. Children with Down syndrome frequently exhibit ligamentous laxity. Which specific cervical spine instability makes rigorous neck manipulation or activities like somersault strictly contraindicated? Option A, C5-C6 hypermobility. Option B, atlantoaxial instability. Option C, cervical rib impingement. Option D, occipito-atlantal fusion. And answer is option B, atlantoaxial instability. Many children with Down syndrome have a dangerous loose transverse ligament in upper neck, leading to atlanto instability. A somersault will cause the vertebra to compress the spinal cord. Okay. Now let's move to question number 68. In clinical research, a physiotherapist measures a patient's knee range of motion with a goniometer on 3 separate occasions and gets the exact same measurement every time. This demonstrates high. Option A, inter-rater reliability. Option B, intra-rater reliability. Option C, construct validity. Option D, external validity. And the answer is option B, intra-rater reliability. Because it is the same therapist getting the same result repeatedly, this is intra-rater reliability. If 2 different therapists got the same result, it would be inter-rater reliability. Okay. Now let's move to question number 69. A 65-year-old patient presents with a suspected massive rotator cuff tear. The therapist abducts the patient's arm to 90 degrees and asks them to slowly lower it to their side. The patient's arm suddenly drops uncontrollably. Which specific muscle is primarily compromised? Option A, teres major. Option B, subscapularis. Option C, supraspinatus. Option D, infraspinatus. And the answer is option C, supraspinatus. This is a positive drop arm test. The supraspinatus initiate abduction and most eccentrically controlled arm coming back down. If it is completely drawn, the patient simply cannot hold the weight of their own arm against gravity. Okay. Now let's move to question number 70. Following a hyperextension injury to the cervical spine, a patient presents with significantly more motor weakness in the upper extremity than in the lower extremity. Which incomplete spinal cord injury syndrome is this? Option A, anterior cord syndrome. Option B, posterior cord syndrome. Option C, Brown Scott syndrome. Option D, central cord syndrome. And the answer is option D, central cord syndrome. In central cord syndrome, the middle of the spinal cord is bruised. Because the nerve tract from the arms run into the central of the cord and the leg tract runs on the outside, the arm is paralyzed, but the patients might still be able to walk. Okay. Now let's move to question number 71. Performing a squat exercise is an example of which type of kinetic chain movement? Option A, open kinetic chain. Option B, closed kinetic chain. Option C, isokinetic movement. Option D, passive kinetic movement. And the answer is option B, closed kinetic chain. In a squat, your feet is firmly fixed to the floor and your body moves over them. Because the distal segment, the fat's feet, is fixed, it's a closed kinetic chain exercise. Okay. Now let's move to question number 72. A 8-year-old boy presents with a painless limb and restricted hip internal and abduction. Radiographer shows a flattened sclerotic femoral head. What is the most likely diagnosis? Option A, slipped capitofemoral epiphysis. Option B, leg clasp Pett's disease. Option C, developmental dysplasia of the hip. Option D, septic arthritis. And the answer is option B, leg clasp Pett's disease. A painful limb in young boy, usually 4 to 10-year-old, with a flattened femoral head on X-ray is a classic leg clasp Pett's disease, which is idiopathic avascular necrosis of the hip. Okay. Now let's move to question number 73. When performing manual chest physical therapy, which of the following is the absolute contraindication for applying percussion and vibration? Option A, chronic bronchitis. Option B, cystic fibrosis. Option C, untreated tension pneumothorax. Option D, asthma without acute bronchospasm. And the answer is option C, untreated tension pneumothorax. This means there is air trapped in the chest cavity, crushing the lung and shifting the heart. Banging on this patient's chest with percussion could cause a fatal cardiac or respiratory collapse. Okay. Now let's move to question number 74. A therapist is using electromyographic biofeedback to facilitate muscle re-education in stroke patient with a very weak extensor carpi radialis. How should the surface electrode be placed initially to capture the maximum signal? Option A, widely spaced apart with high sensitivity. Option B, closely spaced together with low sensitivity. Option C, over the antagonist muscle with high sensitivity. Option D, directly over the muscle tendon with low sensitivity. And the answer is option A, widely spaced apart with high sensitivity. If the muscle is very weak, you need to cast a wide net to catch any electrical activity. You place the electrode far apart and crank up the sensitivity gain on the machine, so even a tiny flicker of movement trigger the feedback. Okay. Now let's move to question number 75. A patient with Parkinson's disease demonstrates a gait pattern characterized by short rapid step that progressively increase in speed as if the patient is trying to catch up with their own center of gravity. This is clinically termed option A, scissor gait. Option B, ataxic gait. Option C, fascinating gait. Option D, step page gait. And the answer is option C, fascinating gait. Because Parkinson's patients lose postural reflex and adopt a stooped posture, their center of gravity falls forward. They end up taking tiny, rapid, shuffling steps to keep themselves from falling flat on their face. Okay? Have reached this point, you are on the right track. So, let's welcome back to the second half of this mega revision series. Let's move to question number 76. A patient who recently suffered a middle cerebral artery stroke walks with their affected leg swing outward in semicircular motion during the swing phase. What is the primary biomechanical reason for this circumduction gait? Option A, hyperactivity, hamstring spasticity. Option B, inability to adequately flex the hip and knee to clear the foot. Option C, weakness of gluteus medius on the unaffected side. Option D, severe cerebral ataxia. And the answer is option B, inability to adequately flex the hip and knee to clear the foot. The stroke has caused the extensor spasticity or profound flexor weakness in the leg. Because they cannot bend their knee and hip to lift the foot off the ground, they have a swing the whole stiff leg out to the side just to take a step. Okay? Now let's move to question number 77. Following an anterior dislocation of the glenohumeral joint, a patient sustained an avulsion of the anterior inferior labrum from the glenoid rim. This specific pathology is known as option A, slap tear, option B, heel slack lesion, option C, Bungard lesion, option D, reverse Bungard lesion. And the answer is option C, Bungard lesion. When the shoulder pops out the front, it often tears the labrum at the bottom front edge from 3 o'clock to 6 o'clock on the socket. This specific tear is a Bungard lesion. Okay. Now let's move to question number 78. A patient in the ICU is being monitored via ECG. The trace shows a complete absence of distinct P waves replaced by rapid irregular fibrillary waves and an irregular RR interval. What is the diagnosis? Option A, ventricular fibrillation. Option B, atrial fibrillation. Option C, third degree heart block. Option D, sinus tachycardia. And the answer is option B, atrial fibrillation. No P waves and an irregular is the textbook definition of atrial fibrillation. The atria is querying instead of pumping properly. Okay. Now let's move to question number 79. When attempting to perform an open kinetic chain knee extension exercise, how does the arthrokinematic glide of the tibia behave in relation to the femur? Option A, rolls and glide posteriorly. Option B, rolls anteriorly and glides posteriorly. Option C, rolls and glide anteriorly. Option D, pure spinning occurs without rolling or gliding. And the answer is option C, rolls and glides anteriorly. The top of the tibia is concave. Based on the concave convex rule, when a concave surface moves on the fixed convex surface, the roll and the glide happens in the exact same direction. So, moving the leg forward means it rolls and glides anteriorly. Okay. Now let's move to question number 80. Children born with myelomeningocele, severe spina bifida frequently develop a Arnold-Chiari type 2 malformation. This anatomical anomaly specifically leads to which secondary condition requiring surgical shunting? Option A, tethered cord syndrome. Option B, hydrocephalus. Option C, syringomyelia. Option D, cerebral aneurysm. And the answer is option B, hydrocephalus. An Arnold-Chiari type 2 malformation pulls the brainstem down to the spinal canal, blocking the flow of cerebrospinal fluid. This fluid backs up into the brain, causing hydrocephalus, which require a VP shunt to drain. Okay. Now let's move to question number 81. The unhappy triad of the knee is a severe injury mechanism usually caused by the lateral blow to the plantar flexed foot. Which three structures are clinically thrown? Option A, ACL, LCL, lateral meniscus. Option B, PCL, MCL, medial meniscus. Option C, ACL, MCL, lateral meniscus. Option D, ACL, MCL, medial meniscus. And the answer is option D, ACL, MCL, medial meniscus. The classic unhappy triad hits the medial side hard. It tears the ACL, that's anterior cruciate ligament, MCL, that's medial collateral ligament, and the medial meniscus. Okay. Now let's move to question number 82. In biomedical research, if data flow a perfectly normal distribution, what percentage of the data points will fall within one standard deviation of the mean? Option A, 95%. Option B, 68%. Option C, 99.7%. Option D, 50%. And the answer is option B, 68%. In a standard bell curve, 68% of people will fall right in the middle within one standard deviation above or below the average. Okay. Now let's move to question number 83. A patient presents with saddle anesthesia, bilateral radicular leg pain, severe lower extremity weakness, and loss of bowel and bladder control following a massive lumbar disc herniation. This is a medical emergency known as option A, clonus medullary syndrome. Option B, central cord syndrome. Option C, Cauda equina syndrome. Option D, lumbar spinal stenosis. And the answer is option C, Cauda equina syndrome. Loss of bowel and bladder control combined with numbness in the saddle area, groin and inner thigh is the ultimate red flag. This is cauda equina syndrome and requires immediate surgery to save the nerves. Okay. Now let's move to question number 84. In rheumatoid arthritis, a patient's finger presents with hyperextension of the proximal interphalangeal joint and flexion of the distal interphalangeal joint. What is this deformity called? Option A, swan neck deformity. Option B, bottom-diet deformity. Option C, mallet finger. Option D, Z deformity of the thumb. And answer is option A, swan neck deformity. When the PIP joint bends forward, that's hyperextended, and DIP dips forward, it mimics the curve of swan neck. Okay. Now let's move to question number 85. Pursed lip breathing is a critical technique taught to the patient with emphysema. What is the primary physiological mechanism by which this technique prevents the airway collapse? Option A, it increases the respiratory rate to blow off more CO2. Option B, it creates positive end expiratory pressure to keep bronchioli open. Option C, it strengthens the diaphragm concentrically. Option D, it decreases the tidal volume to reduce hyperinflation. And the answer is option B, it creates positive end expiratory pressure PEEP to keep bronchioli open. Emphysema destroys the lungs' elasticity, makes airway collapse when exhaling. Exhaling slows against the pursed lip act like a back pressure valve, keeping the airway popped open longer to trapped air can escape. Okay. Now let's move to question number 86. During therapeutic ultrasound, the formation, growth and violent collapse of the air bubbles in the tissue fluid that can cause localized tissue destruction is known as option A, acoustic streaming. Option B, stable cavitation. Option C, unstable cavitation. Option D, micromassage. And answer is option C, unstable cavitation. Cavitation refers to the gas bubble pulsing into the sound waves. Stable cavitation is good for healing, but if the intensity is too high, the bubble violently explodes. This is unstable cavitation and it damages cells. Okay. Now let's move to question number 87. The gag reflex is a vital protective mechanism. Which cranial nerve are responsible for afferent and efferent limb of this reflex respectively? Option A, cranial nerve 5 and cranial nerve 7. Option B, cranial nerve 9 and cranial nerve 10. Option C, cranial nerve 10 and cranial nerve 12. Option D, cranial nerve 7 and cranial nerve 9. And answer is option B, cranial nerve 9, that's glossopharyngeal, and cranial nerve 10, that's vagus. When something touches the back of the throat, cranial nerve 9 feels it sensory or afferent, and cranial nerve 10 makes the throat muscle contract to gag. Okay. Now let's move to question number 88. A physical therapist performs the Thomas test on a patient. The patient's posterior thigh lifts off the table, but the knee remains flexed at 90 degrees. This specifically indicates tightness of which muscle? Option A, rectus femoris. Option B, iliopsoas. Option C, tensor fascia lata. Option D, sartorius. And the answer is option B, iliopsoas. During the Thomas test, if the thigh lifts off the bed, it's a hip flexor issue. Because the knee is able to stay bent at 90 degree, the rectus femoris is not the culprit. The tightness is isolated to iliopsoas. Okay. Now let's move to question number 89. A physical therapist suspects a patient is experiencing physical abuse at home. According to the medical ethics principle of non-maleficence and the legal mandates, what is the therapist's immediate obligation? Option A, confront the suspect abuser directly. Option B, document the suspicion but maintain patient confidentiality above all else. Option C, report the suspicion to the appropriate adult or child protective service or authority. Option D, discharge the patient to remove them from your facility liability. And the answer is Option C. Report the suspicion to the appropriate adult or child protective service or authorities. Non-maleficence means to do no harm and protecting a vulnerable patient from ongoing abuse overrides standard confidentiality. You are legally a mandatory reporter. Okay? Now let's move to question number 90. During the push-off phase of the gait cycle, which muscle group is primarily active and what type of contraction is occurring? Option A. Ankle dorsiflexor eccentric. Option B. Knee extensor concentric. Option C. Ankle plantar flexor concentric. Option D. Hip flexor isometric. And the answer is option C. Ankle plantar flexor concentric. To propel the body forward during push-off, the calf muscle, plantar flexors, must fire powerfully to lift off the heel and push off the toes. This shortening action is concentric contraction. Okay? Now let's move to question number 91. When stroking the lateral sole of the foot from the heel to the base of the toes, a patient exhibits extension of big toes and fanning of the other toes. This is called positive Babinski sign, which indicates option A. Peripheral neuropathy. Option B. Lower motor neuron lesion. Option C. Upper motor neuron lesion. Option D. Normal adult response. And the answer is option C. Upper motor neuron lesion. A positive Babinski sign is normal for babies, but not in adult. It is a massive red flag. It proves there is a damage to the central nervous system, specifically an upper motor neuron lesion. Okay? Now let's move to question number 92. A adult suffers from lateral ankle sprain by landing on a fully plantar flexed and inverted foot. Which ligament is most likely to be injured first? Option A. Calcaneofibular ligament. Option B. Anterior talofibular ligament. Option C. Posterior talofibular ligament. Option D. Deltoid ligament. And answer is option B. Anterior talofibular ligament. The ATFL is the weakest of the lateral ankle ligaments and perfectly positioned to tear when the foot is pointed down and rolled inward. Okay. Now let's move to question number 93. A patient is entering phase 3 of cardiac rehabilitation program. Which of the following best describe the clinical setting and monitoring the level of this phase? Option A. Inpatient continuous ECG monitoring. Option B. Outpatient continuous ECG telemetry monitoring. Option C. Community-based independent self-monitoring with periodic clinical check-ins. Option D. Complete discharge from all cardiovascular exercise. And the answer is option C. Community-based independent self-monitoring with periodic clinical check-ins. Phase 1 is in the hospital. Phase 2 is the outpatient with EKG wire glued to you. Phase 3 is maintenance phase. You are at the community gym monitoring your own heart rate safely independent. Okay. Now let's move to question number 94. Low level laser uses helium neon gallium arsenide diodes. What is the typical wavelength range from helium neon laser which produce visible red light? Option A. 904 nanometers. Option B. 632.8 nanometers. Option C. 1 megahertz. Option D. 27.12 megahertz. And the answer is option B. 632.8 nanometers. Helium neon lasers are visible red beam and the specific wavelength that creates the red light is 632.8 nanometers. Okay. Now let's move to question number 95. In typical pediatric motor development, at what age range should an infant normally achieve the milestone of sitting completely independently without any arm support? Option A. 3 to 4 months. Option B. 6 to 8 months. Option C. 10 to 12 months. Option D. 15 to 18 months. And the answer is option B. 6 to 8 months. A baby typically leans to sit by popping themselves on their hands around 5 to 6 months. But by 6 to 8 months, their core strength is enough to sit totally unsupported and play with toys. Okay. Now let's move to question number 96. A 60-year-old male presents with bilateral leg pain that worsens with walking and standing straight up extension, but is completely relieved by sitting down and leaning forward. That's flexion. Which spinal protocol is most indicated? Option A, McKenzie extension protocol. Option B, William flexion protocol. Option C, Maitland's grade 4 PA mobilization. Option D, heavy deadlift. And the answer is option B, William flexion protocol. This patient has classic lumbar spinal stenosis. Their spinal canal is too tight. Bending forward opens up the spine and relieves the nerve pressure. Therefore, you treat them with a William flexion bias protocol. Okay. Now let's move to question number 97. In clinical setting, if a newly developed balance test is compared against the Berg balance scale called standard to prove its accuracy, the researchers are trying to establish option A face validity, option B content validity, option C criterion related validity, option D inter-rater reliability. And the answer is option C criterion related validity. When you compare a brand new test to the existing gold standard test to see if the measure up, you are checking its criterion related validity. Okay. Now let's move to question number 98. The vestibulo-ocular reflex serves what primary function in human body? Option A, it causes the eye to close automatically when a loud noise occurs. Option B, it maintains stable gaze on the target while the head is moving. Option C, it regulates pupil dilation in response to light. Option D, it triggers nystagmus during sleep. And the answer is option B, it maintains stable gaze on the target while the head is moving. The VOR is what allows you to shake your head no while keeping your eyes perfectly locked on my face. It moves your eyes at the exact same speed but in the opposite direction as your head. Okay? Now let's move to question number 99. When using mechanical lumbar traction to achieve true vertebral separation and decompression of the nerve root, what percentage of the patient's body weight is generally recommended as the required force? Option A 10%, option B 25%, option C 50%, option D 100%. And the answer is option C 50%. To actually pull the lumbar vertebrae apart, you need a heavy force, specifically 50% of patient's total body weight. Anything less is just stretching the muscles. Okay? Now let's move to question number 100. Congratulations on reaching this question number 100. Let's lock in with biomechanics. In the shoulder complex, which two muscles from a couple force to create upward rotation of the scapula during arm elevation? Option A, rhomboid and levator scapulae. Option B, upper trapezius and serratus anterior. Option C, pectoralis minor and latissimus dorsi. Option D, supraspinatus and infraspinatus. And the answer is option B, upper trapezius and serratus anterior. To lift your arm all the way up, the shoulder blade has to rotate upward. The upper trapezius pulls up, the lower trapezius pulls down, and serratus anterior pulls forward. This creates coupled force that spin the scapula smoothly. Okay? Now let's move to question number 101. A patient complains of burning pain and tingling on the plantar surface of the foot and the toes. The symptoms worsen with prolonged standing. Tapping behind the medial malleolus reproduces the symptom. Which nerve is trapped in the tarsal tunnel syndrome? Option A, posterior tibial nerve. Option B, deep peroneal nerve. Option C, sural nerve. Option D, saphenous nerve. And the answer is option A, posterior tibial nerve. Just like carpal tunnel syndrome in the wrist, tarsal tunnel happens in the ankle. The posterior tibial nerve gets squeezed inside the ankle bone, that's medial malleolus, causing burning pain on the sole of the foot. Okay? Now let's move to question number 102. A 30-year-old female present with fluctuating muscle weakness that worsens with exercise and improves with rest. She specifically complains of drooping eyelids, ptosis, and difficulty chewing at the end of the day. What is the primary pathophysiology of this disease? Option A. Demyelination of the peripheral nerve. Option B. Degeneration of the anterior horn cell. Option C. Autoimmunodestruction of acetylcholine receptors at the neuromuscular junction. Option D. Depletion of dopamine in the substantia nigra. And the answer is Option C. Autoimmunodestruction of the acetylcholine receptors at the neuromuscular junction. Weakness that gets worse as the day go on, especially in the face and the eyes, is the classic sign of myasthenia gravis. It happens because the body destroys its own acetylcholine receptors, blocking the nerve signals from reaching the muscle. Okay. Now let's move to question number 103. In a healthy adult, what is the normal range of left ventricular ejection fraction as measured by an electrocardiogram? Option A 100%, option B 25 to 35%, option C 40 to 50%, option D 55 to 70%. And the answer is option D 55 to 70%. The heart never pumps out 100% of blood inside it. A normal healthy heart pumps out about 55 to 70% of its volume with each beat. Anything below 40 usually indicate heart failure. Okay. Now let's move to question number 104. When utilizing interferential current for pain management, two medium frequency alternating currents are intersected. If one channel is set at 4000 Hz and channel 2 is set to 4100 Hz, what is the resulting beat frequency delivered to the deep tissue? Option A 8100 Hz, option B 100 Hz, option C 4050, option D 1 Hz. And the answer is option B 100 Hz. IFC works by crossing two different frequencies. The body feels the difference between the two. So 4100 minus 4000 equals the beat frequency of 100 Hz. Okay. Now let's move to question number 105. According to the concave convex rule, when mobilizing the carpometacarpal joint of the thumb to increase flexion and extension, what are the arthrokinematic of the first metacarpal moving on the trapezium? Option A, concave moving on convex, roll and glide are in the same direction. Option B, convex moving on concave, roll and glide are in the opposite direction. Option C, concave moving on convex, roll and glide are in the opposite direction. Option D, convex moving on concave, roll and glide are in the same direction. And the answer is option A, concave moving on the convex, roll and glide are in the same direction. The thumb CMC joint is a saddle joint. For flexion and extension, the base of the metacarpal is concave, like a bow moving on convex trapezium. So, concave on convex means the roll and the glide are in the same direction. Okay. Now let's move to question number 106. A 13-year-old female presents with a idiopathic structural scoliosis. Her corpse angle is measured at 35 degrees of AP radiograph. She has significant growth potential remaining. What is the most appropriate evidence-based medical management? Option A, surgical spinal fusion immediately. Option B, observation and monitoring only. Option C, spinal orthosis combined with physiotherapy. Option D, absolute bed rest. And the answer is option C, spinal orthosis combined with physiotherapy. For a growing child with curve between 25 to 45 degrees, bracing is the gold standard to stop the curve from getting worse. Surgery is generally served for curves over 45 to 50 degrees. Okay. Now let's move to question number 107. A difficult vaginal delivery results in an injury to the lower root of the newborn's brachial plexus. The infant presents with claw hand deformity but normal shoulder and elbow function. What is the condition called? Option A, Erb's-Duchenne palsy. Option B, Bell's palsy. Option C, cerebral palsy. Option D, Kumblick's palsy. And the answer is option D, Kumblick's palsy. Erb's palsy hits the upper root, causing the waiter's stiff posture at the shoulder. Kumblick palsy hits the lower root, sparing the shoulder but paralyzing the small muscles of hand and creating a claw hand. Okay. Now let's move to question number 108. A patient presents with a wound on the medial aspect of the lower leg, just above the medial malleolus. The wound has irregular borders, a highly exudative red base, and the surrounding skin is deeply hyperpigmented. What is the most likely etiology? Option A, atrial insufficiency. Option B, venous insufficiency. Option C, diabetic neuropathy. Option D, pressure. And answer is option B, venous insufficiency. A wet, leaky wound near the medial malleolus with broken, stained skin around it is the classic textbook description of a venous ulcer. The blood gets pumped down to the leg but cannot get back up, so it pulls and breaks down the tissue. Okay? Now let's move to question number 109. When applying mechanical cervical traction to treat a C5-C6 nerve root impingement, what is generally recommended pulling force required to achieve actual vertebral separation? Option A, 20 to 30 lbs. Option B, 5 to 10 lbs. Option C, 50 to 60 lbs. Option D, 100 lbs. And the answer is option A, 20 to 30 lbs, approximately 7 to 10% of the body weight. Okay. For the neck, 5 to 10 pounds, just stretch the muscle. To actually pull the cervical vertebra apart, really pinch nerve, you need roughly 20 to 30 pounds of force. Okay. Now let's move to question number 110. Which pediatric genetic disorder is characterized by the progressive degeneration of the anterior horn of the spinal cord, leading to profound symmetrical muscle weakness and atrophy with intact sensation? Option A, Duchenne muscular dystrophy. Option B, spina bifida. Option C, spinal muscular atrophy. Option D, cystic fibrosis. And the answer is option C, spinal muscular atrophy, SMA. Degeneration of the anterior horn cells, the motor cells in the spine, is spinal muscular atrophy. Sensation is perfectly normal, but the motor nerves dies, leading to severe weakness. Okay. Now let's move to question number 111. In a clinical trial, a researcher wants to compare the effectiveness of 3 different ultrasound intensity, low, medium, high, on reducing pain score. Which statistical test is the most appropriate to analyze the difference between these 3 independent groups? Option A, independent t-test. Option B, Pearson correlation coefficient. Option C, chi-square test. Option D, analysis of variance. And the answer is option D, analysis of variance. A t-test is used to compare 2 groups. The moment you have 3 or more groups, you must use a ANOVA test. Okay. Now let's move to question number 112. When evaluating patient's standing posture from a lateral view using a plumb line, where should the line ideally pass in relation to the knee joint? Option A, posterior to the patella and posterior to the joint axis. Option B, anterior to the joint axis but posterior to the patella. Option C, directly through the lateral malleolus. Option D, anterior to the patella. And the answer is option B, anterior to the joint axis but posterior to the patella. For ideal posture, the gravity line should fall just in front of the knee joint's center of rotation. This naturally locks the knee into extension, so you don't have to constantly use your quads muscle just to stay standing. Okay. Now let's move to question number 113. A 45-year-old carpenter presents with pain on the lateral side of the elbow that worsen when the gripping tools and extending the wrist against resistance. The diagnosis is lateral epicondylitis, that's tennis elbow. Which muscle tendon is most commonly involved? Option A, extensor carpi radialis brevis. Option B, extensor carpi ulnaris. Option C, flexor carpi radialis. Option D, pronator teres. And the answer is option A, extensor carpi radialis brevis. Tennis elbow is an overuse injury of the wrist extensor. While multiple muscle attached on the lateral epicondyle, extensor carpi radialis brevis is always the primary tendon that gets damaged and inflamed. Okay. Now let's move to question number 114. A patient with a cerebellar lesion is asked to touch their nose and then touch the therapist's finger. The patient overshoots the therapist's finger repeatedly. This inability to accurately judge the distance or scale of movement is clinically termed. Option A, dysdiadochonesia. Option B, dysphagia. Option C, nystagmus. Option D, dysmetria. And the answer is option D, dysmetria. Metria means measure. Dysmetria means bad measuring. The patient cannot measure the distance to the target, so they overshoot or undershoot. It is a hallmark sign of cerebellar damage. Okay. Now let's move to question number 115. A patient in cardiac rehabilitation program is practicing activities of daily living, brushing teeth, washing hands, and eating while sitting generally required an energy expenditure of option A, less than 1 MET, option B, 1 to 2 MET, option C, 4 to 5 MET, option D, 7 to 8 MET. And the answer is option B, 1 to 2 MET. 1 MET is the energy you burn while sitting completely still. Your light-seated tasks like brushing your teeth or eating use just slightly more energy, usually around 1 to 2 METs. Okay? Now let's move to question number 116. When applying an ice pack to the acute injury, the initial response is vasoconstriction. However, if the cord is applied for longer than 15 to 20 minutes, the blood vessels may cyclically dilate and constrict. This physiological safety mechanism is known as option A, gate control theory, option B, inflammatory cascade, option B, the Hunting response, option D, Raynaud's phenomena. And the answer is option C, the Hunting response. To prevent your tissue from getting frostbite and dying, the body will eventually force blood back into the frozen area. This cyclic opening and closure of the blood vessel to save the tissue from the cold damage is known as the Hunting response. Okay. Now let's move to question number 117. A severe axial loading injury to the head can result in a highly unstable burst fracture of C1 atlas ring. What is the eponymous name for this specific fracture? Option A, Jefferson's fracture, option B, Hangman fracture, option C, Clashover's fracture, option D, teardrop fracture. And the answer is option A, Jefferson fracture. When you drive head first and compress the spine, the C1 ring shattered outward like a broken rocknet. This is Jefferson fracture. Okay. Now let's move to question number 118. A plea maneuver is highly effective treatment for posterior canal BPV. What is the fundamental biomechanical goal for this specific sequence of head movement? Option A, to stretch the sternocleidomastoid. Option B, to habituate the central nervous system to vertigo. Option B, to physically reposition displaced otoconia from the semicircular canal back into the utricle. Option D, to clear a blockage in the Yshak tube. And the answer is option C, to physically reposition displaced otoconia from the semicircular canal back into the utricle. BPPV happens because tiny ear crystal falls into the wrong ear canal. The Epley maneuver is essentially a gravity puzzle. You are physically rolling patient's head to dump those crystals out of the canal and back into the utricle where they belong. Okay. Now let's move to question number 119. A pediatric patient presents with frequent bone fracture from minimal trauma, bluish discoloration of the sclera, and generalized joint hypermobility. This clinical presentation is a classic for a genetic disorder affecting type 1 collagen synthesis known as option A, achondroplasia, option B, juvenile idiopathic arthritis, option C, Marfan syndrome, option D, osteogenesis imperfecta. And the answer is option D, osteogenesis imperfecta. Frequent fractures and blue sclera are the textbook giveaways of osteogenesis imperfecta, also known as brittle bone disease. The body cannot make strong type 1 collagen. Okay? Now let's move to question number 120. A physiotherapist takes a photo of patient's interesting wound and posts it private social media group for physiotherapists to ask for treatment advice without the patient's explicit written consent. Even if patient face is not in the photo, this is violation of option A, principle of beneficence, option B, patient confidentiality and private law, option C, the principle of justice, option D, it is not a violation because it is for educational purpose. And the answer is option B, patient confidentiality and private laws. It does not matter if it's for an educational group or if their face isn't in it. Posting any patient's data or photos without explicit written consent is a massive breach of patient's confidentiality and can get your license revoked. Okay. Now let's move to question number 121. In the human body, which class of liver system is most common, designed primarily for producing a large range of motion and speed rather than the raw power? Option A, third class liver, option B, second class liver, option C, first class liver, option D, fourth class liver. And the answer is option A, third class liver. Third class livers are everywhere in the body, like your biceps doing a curl. The effort the muscle is between the fulcrum, the joint, and the load weight. They give you the bad leverage for heavy lifting, but they allow you to move your limbs incredibly fast through a huge range of motion. Okay. Now let's move to question number 122. A 14-year-old male basketball player complains of anterior knee pain just below the kneecap that worsened with jumping and running. Palpation reveals an enlarged tender tibial tuberosity. What is the most likely diagnosis? Option A, patellar tendinopathy. Option B, chondromalacia patellae. Option C, Osgood-Schlatter disease. Option D, prepatellar bursitis. And the answer is option C, Osgood-Schlatter disease. This pain specifically at the tibial tuberosity in the growing active teenager is Osgood-Schlatter disease. The tight quads muscle is literally pulling the growth plate away from the bone. Okay. Now let's move to question number 123. A patient who suffered a stroke presents with left-sided hemiplegia. Behaviorally, this patient is likely to exhibit which characteristic traits compared to someone with right-sided hemiplegia? Option A, slow, cautious behavior and extreme awareness of their deficit. Option B, severe expressive aphasia and frustration. Option C, intact spatial perceptual ability. Option D, impulsive behavior, poor judgment and overestimation of their ability. And the answer is option D, impulsive behavior, poor judgment and overestimation of their ability. A patient with left-sided weakness has damage to right brain. The right brain controls spatial awareness and judgment. These patients are often impulsive, unaware of their defect, and a huge fall risk because they think they can walk when they can't. Okay. Now let's move to question number 124. During a excess tolerance test, a patient points to a 15 of box rating of perceived exertion RPE scale. Based on the original 6 to 12 scale design, this correlates to an estimated heart rate approximately option A 110 bpm, option B 150 bpm, option C 180 bpm, option D 85 bpm. And the answer is option B 150 bpm. The original box scale goes from 6 to 20 for a very specific reason. If you multiply the number by 10, it gives you a rough estimate of patient's heart rate. So, an RPE of 15 means the heart rate is roughly 150 beats per minute. Okay. Now let's move to question number 125. Continuous shortwave diathermy produces deep heating via electromagnetic energy. Which of the following is an absolute contraindication for the use of SWD anywhere on the body? Option A cardiac pacemaker. Option B, a history of asthma. Option C, muscle spasm in the target area. Option D, chronic osteoarthritis. And answer E is option A cardiac pacemaker. Shortwave diathermy use powerful radioactive waves. If a patient has a pacemaker, those waves can interfere with the device and stop the patient's heart. It is an absolutely forbidden. Okay. Now let's move to question number 126. A patient with a severe traumatic brain injury (TBI) exhibit abnormal posturing characteristic by rigid extension of arms, internal rotation of shoulder, and extension of legs. This clinically identified as option A, decorticate posturing. Option B, decerebrate posturing. Option C, opisthotonous. Option D, spastic diaplegia. And the answer is option B, decerebrate posturing. When the arm and leg are both rigidly extended straight out, it is decerebrate posturing. It indicates severe damage deep in the brainstem below the red nucleus. Okay. Now let's move to question number 127. When evaluating pulmonary function test, which combination of lung volumes constitute the vital capacity? Option A, tidal volume plus residual volume. Option B, inspiratory reserve volume plus expiratory reserve volume. Option C, tidal volume plus inspiratory reserve volume plus expiratory reserve volume. Option D, total lung capacity minus inspiratory capacity. And the answer E is option C, tidal volume plus inspiratory reserve volume plus expiratory reserve volume. Vital capacity is an absolute maximum amount of air you can breathe in and out. It includes your normal breath plus the extra you can force in IRV plus the extra you can force out ERV. It does not include the residual volume which already stay trapped in the lungs. Okay. Now let's move to question number 128. According to the Alfredson protocol, which is considered the gold standard for treating mid-portion Achilles tendinopathy, what is the primary type of muscle contraction utilized? Option A, high speed concentric. Option B, high load slow eccentric. Option C, long duration isometric. Option D, pilometric. And the answer is option B, heavy load slow eccentric. The Alfredson protocol relies on eccentric loading, specifically dropping the heel down slowly over a step. This slow, heavy lengthening phase stimulates the tendon to remodel and heal completely. Okay. Now let's move to question number 129. When using TENS based on the gate control theory, which specific nerve fibers are being targeted by electrical stimulation to block pain signals? Option A, unmyelinated C fiber. Option B, large myelinated A beta fiber. Option C, small myelinated A delta fiber. Option D, motor efferent fibers. And the answer is option B, large myelinated A beta fiber. TENS sends a comfortable buzzing sensation through the fast, large A beta fiber. These fast signals reach the spinal cord first and close the gate on the slower pain signal coming from the C fibers. Okay. Now let's move to question number 130. According to the latest American Heart Association guideline for high quality CPR in adult, what is recommended rate of chest compression? Option A, 80 to 100 compression per minute. Option B, exactly 100 compression per minute. Option C, 100 to 120 compression per minute. Option D, 120 to 140 compression per minute. And the answer is option C, 100 to 120 compression per minute. The golden rule for CPR compression is 100 to 120 beats per minute. Push hard and push fast. Okay. Now let's move to question number 131. A patient with a spinal cord injury developed a fluid-filled cavity within the central spinal cord, leading to cape-like bilateral loss of pain and temperature sensation across the shoulder and upper arm. This condition is called option A, syringomyelia. Option B, multiple sclerosis. Option C, Tape's dorsalis. Option D, anterior cord syndrome. And the answer is option A, syringomyelia. A syrinx is a cyst in the spinal cord. When it expands, it destroys the crossing pain and temperature fiber first, creating a classic cape-like numbness across the back and shoulder. This is syringomyelia. Okay. Now let's move to question number 132. A physical therapist prescribes a solid AKFO or angle foot orthosis for a stroke patient. If AFO is specifically cast and set in 5 degree of plantar flexion, what biomechanical effect will this have at the knee during the stance phase of the gait? Option A, it will provoke knee flexion. Option B, it will provoke knee extension. Option C, it will cause excessive angle dorsiflexion. Option D, it will have no effect on the knee. And the answer is option B, it will promote knee extension or hyperextension. The angle and the knee are connected in kinetic chain. If you lock the angle pointing down, plantar flexion, it forces the tibia backward when the foot hits the floor, shoving the knee into extension or hyperextension. Okay. Now let's move to question number 133. In medical ethics, if a physical therapist actively advocates for a treatment plan that will maximize the positive functional outcome for their patient, they are primarily demonstrating the principle of option A, non-maleficence, option B, beneficence, option C, justice, option D, veracity. And the answer is option B, beneficence. Beneficence means doing good. It is the active step of providing the absolute best, most effective care to benefit your patient's life. Okay? Now let's move to question number 134. Which special test is specifically designed to isolate the integrity of the supraspinatus muscle by placing the shoulder in 90 degree of scaption with full internal rotation? Option A, near test. Option B, speed test. Option C, empty can test or jobs test. Option D, Gerber lift off test. And the answer is option C, empty can test. Pointing the thumb down to the floor, full internal rotation, scapular plane act just like emptying a can of soda. This put the deltoid at disadvantage and forced the supraspinatus to do all the work against your resistance. Okay. Now let's move to question number 135. Immediately following birth, an infant's physiological status is assessed using the APGAR score. At what specific time interval is this score routinely recorded? Option A, 5 minutes and 10 minutes. Option B, 1 minute and 5 minutes. Option C, 10 minutes and 30 minutes. Option D, 1 hour and 2 hours. And the answer is option B, 1 minute and 5 minutes. It is a quick test to see how well the baby handled the birthing process. It is done exactly at 1 minute after birth and again at 5 minutes after birth. Okay. Now let's move to question number 136. A patient recovering from a right hemisphere stroke exhibits Pushow syndrome. During sitting or standing balance activity, the patient will actively push their body weight. Option A, towards the strong unaffected side. Option B, backward into posterior pelvic tilt. Option C, towards the weak hemiplegic side. Option D, forward into extreme trunk flexion. And the answer is option C, towards the weak hemiplegic side. This is a tricky paradoxical condition. Patients with Pushow syndrome actively use their strong arm and leg to violently push themselves over onto their weak paralyzed side, resulting in a high fall risk. Okay. Now let's move to question number 137. According to Maitland's grade of mobilization, a grade 3 mobilization is characterized by option A, small amplitude movement at the beginning of the available range. Option B, large amplitude movement reaching the limit of tissue resistance. Option C, small amplitude movement at the very limit of tissue resistance. Option D, high velocity, low amplitude thrust past the limit of resistance. And the answer is option B, large amplitude movement reaching the limit of tissue resistance. Think of Maitland's grade like stretching a rubber band. Grade 1 and grade 2 just wrinkle the stack. Grade 3 is a large, deep movement that pushes right into the stiffness and resistance to stretch the capsule. Okay. Now let's move to question number 138. A physiotherapist is using therapeutic ultrasound to treat chronic contracture of the superficial wrist flexor. Which frequency is most appropriate to target this shallow tissue? Option A, 1 MHz, option B, 3 MHz, option C, 27.12 MHz, option D, 50 MHz. And the answer is option C, 3 megahertz. Higher the frequency, get absorbed faster. So 3 megahertz absorbs its energy quickly in the superficial tissue like wrist. 1 megahertz penetrate more deeper for like the low back and deeper hip capsule. Okay. Now let's move to question number 139. In respiratory physiology, what is the normal resting respiratory rate for a healthy adult? Option A, 8 to 10 breath per minute. Option B, 12 to 20 breath per minute. Option C, 20 to 30 breath per minute. Option D, 30 to 40 breath per minute. And the answer is option B, 12 to 20 breath per minute. A normal adult breath between 12 to 20 times per minute at rest. Anything below 20 is bradypnea and anything above 20 is trachypnea. Now let's move to question number 140. Which diagnostic metric tells a clinician how accurately a clinical test rules out a disease when the test result is negative? Option A, sensitivity. Option B, specificity. Option C, positive predictive value. Option D, inter-rater reliability. And the answer is option A, sensitivity. Remember the mnemonic SNOT. A test with high sensitivity, when negative, rule out the disease. It catches everyone who has a problem. So if it says you are clear, you are truly clear. Okay. Now let's move to question number 141. The close back position of a joint is where the joint capsule and ligaments are maximally taut and joint surfaces are maximally congruent. What is the close back position of the glenohumeral joint? Option A, full flexion and internal rotation. Option B, 55 degree of abduction, 30 degree of horizontal adduction. Option C, full abduction and external rotation. Option D, full extension and internal rotation. And the answer is option C, full abduction and external rotation. If you want to lock the shoulder joint tight, close back position, you bring the arm all the way up to ear, full abduction, and twist it outward. That's external rotation. Okay. Now let's move to question number 142. Following transfemoral above knee amputation, what is the most common and problematic contracture that develop in residual limb? Option A, hip extension and adduction. Option B, hip flexion and internal rotation. Option C, hip flexion and abduction. Option D, hip extension and external rotation. And the answer is option C, hip flexion and abduction. When the leg is cut above the knee, you lose the heavy weight of the leg and the pull of the adductors. The strong hip flexors and abductors take over, pulling the stem up and outward. That's flexion and abduction. Okay. Now let's move to question number 143. According to the rule of 9 used to estimate total body surface area affected by burns in an adult, what percentage is assigned to the entire anterior and posterior surface of one lower extremity? Option A, 9%. Option B, 18%. Option C, 36%. Option D, 4.5%. And the answer is option B, 18%. In an adult, one whole leg, that's front and back combined, equals to 18% of their total body surface area. Each arm is 9%, the whole front of the trunk is 18%, and the whole back is 18%. Okay. Now let's move to question number 144. During a gait assessment, a patient exhibits a backward lunge of their trunk immediately following initial contact, that's heel strike, on the right side. This compensatory movement is due to weakness in which muscle? Option A, right gluteus medius. Option B, right gluteus maximus. Option C, left iliopsoas. Option D, right quadriceps. And the answer is option B, right gluteus maximus. At the heel strike, your body wants to pitch forward. The gluteus maximus fires to pull you upright. If the glute is weak, you have to violently throw your shoulder backward to keep from falling forward. Okay? Now let's move to question number 145. Ethitoid or dyskinetic cerebral palsy is characterized by slow, writing, involuntary movement. Which specific area of the brain is damaged to cause this type of CP? Option A, motor cortex. Option B, cerebellum. Option C, basal ganglia. Option D, brainstem. And the answer is option C, basal ganglia. The basal ganglia act as the brain's volume control for movement. When it is damaged, movements become uncoordinated, slow and worm-like. Okay? Now let's move to question number 146. A patient in ICU developed ventricular tachycardia. Which of the following describe the classic appearance of VTach on a ECG? Option A flat isoelectric line. Option B, normal QRS complex with rate of 110 bpm. Option C, series of wide bizarre QRS complex with no visible P wave. Option D, sawtooth flutter waves. And the answer is option C, series of wide bizarre QRS complex with no visible P waves. Ventricular tachycardia looks like a series of wide, ugly mountain on the ECG. The ventricles are firing so fast that there are no P waves, just massive wide QRS complex in a row. This is a medical emergency. Okay? Now let's move to question number 147. Cyriax deep transverse friction massage is widely used for chronic tendinopathies. Which of the following is an absolute contraindication for this technique? Option A, chronic tennis elbow. Option B, supraspinatus tendinosis. Option C, calcific tendinitis or ossification in soft tissue. Option D, ligamentous sprain in subacute remodeling phase. And the answer is option C, calcific tendinitis or ossification in soft tissue. Friction massage rub the tissue aggressively to break down the scar tissue. If a patient has calcification, rubbing is vigorously while the cause excruciating pain and further damage. Okay? Now let's move to question number 148. A patient is undergoing a painful wound debridement. To provide immediate and temporary pain relief during the brief procedure, the physiotherapist applies brief intense tense. What is the primary physiological mechanism of this mode? Option A, gait control via A beta fiber. Option B, release of long-lasting endorphin. Option C, noxious stimulation of blocking pain pathways, descending inhibition. Option D, vasodilation to flush out substance P. And the answer is option C, noxious stimulation blocking pain pathways. Brief intense tense use very high frequency and very high intensity to essentially short circuit the nervous system. It causes mild nauseous painful stimulation that triggers the brain to block the sharp pain of wound cleaning. Okay? Now let's move to question number 149. The feed-forward mechanism of core stability refers to the anticipatory contraction of deep stabilizing muscle before a limb move. Which muscle is primary feed-forward stabilizer of lumbar spine? Option A, rectus abdominis. Option B, transverse abdominis. Option C, external oblique. Option D, latissimus dorsi. And the answer is option B, transverse abdominis. Before you even lift your arm or leg, your brain tells the transverse abdominis, your body, to build a corset. Your body's built-in corset to tighten up and protect the spine. This happens automatically milliseconds before the movement. Okay? Now let's move to question number 150. For the final question of this ultimate series, the visual inspection of the patient reveals a step of deformity of the lumbar sacral junction. The patient reports a severe pain with lumbar extension and relief with flexion. The condition is a bilateral paras interarticularis defect with anterior translation. This is a definitive diagnosis of option A, spinal stenosis. Option B, ankylosing spondylitis. Option C, spondylolisthesis. Option D, disc herniation. And answer is option C, spondylolisthesis. A step of deformity means you can literally feel a step where one vertebra had slide completely forward over the one below it. This is a severe spondylolisthesis. Bending backward pinches it, bending forward relieves it. Okay? And this is 150. You have just completed the most comprehensive high-yield physiotherapy exam revision series on the internet. If you were able to complete till this point, you are the best. Drop a comment below saying I finished 150 so that I can personally congratulate you. Remember, memorizing the answer isn't enough. You have to understand why. That is why I uploaded a completely free, deeply detailed explanation with every single textbook reference to inside our description and also in the Telegram channel. Do not let 2026 be the year you almost passed. Smash the like button, subscribe to this channel and keep grinding. Your dream job is waiting. I will see you in the next masterclass and all the best. Thank you for watching till this point.